talk about from your perspective what you're seeing.
Siobhan, I've been the juvenile court judge for the last 12 years, and during that time, my drug court has grown from about 25 youth to 125 youth. And 5 years ago, frankly, I never saw a heroin case, and now 20% of my kids are on heroin. So it's a tragedy that's hit this community. I'm glad you're doing this story because so often we think of heroin dealing with adults. People don't realize that we have children 14, 15, 16 who are heroin addicts already. And that's what I'm doing. I'm touching those children who come to me at 14, who started using drugs when they were 11, but now at 14 are using heroin and fentanyl.
You mentioned that you said 5 years ago you weren't seeing a heroin case. As far as the short time that this has become such a problem, is it overburdening a lot of the state systems? Is it overburdening the courts?
Well, it's made the courts have to work much differently than we did in the past, and we've had to change what we've been doing and how we touch children. When children were using marijuana, that was a drug that had to be dealt with, but marijuana use didn't turn into overnight fatalities. Heroin is turning into overnight fatalities. And so, even in my courtroom now, I have Narcan available because there may be a child in the middle of my court hearing who ODs. And so, sure, we've changed. We've had to have more advanced techniques available to save children's lives. We have to have more people on staff who are trained in how to deal with children who are ODing. It's changed dramatically. It doesn't mean that my caseload's gone up. It just means the severity of each case has become much harder, much more fearful. Nowadays, and I'll say one way it's changed, I've been doing drug court for 12 years and I never received updates every day when a child's brought in what they've been tested dirty for. It just got so bad in the last 6 months that now every child that comes through my building that's tested, I'm getting an email as to what in their system. And so often now it's not just marijuana, it's marijuana, cocaine, heroin, and fentanyl. And so sure, it's changed the way we do business. We've had to because we have children at risk overnight versus, I guess the simplest way to say it is we had children that we could give treatment to, and over a period of time, we could get them off of drugs and help treat them slowly. Now with the heroin issues, we were losing children overnight. And so we can't take that time, but we don't have the warning. I guess that's the quickest way to say it, is that children nowadays, they don't know what they're taking. And that's really the biggest problem. They don't know if they're taking heroin, fentanyl, cocaine, but it seems like everything they're getting is heroin with fentanyl included, which is the killer drug.
Where are the families of these children?
Some of them are addicted themselves. Some of them don't even know their children are using. There's a lot of families that have traumatic life experiences, and so I don't want to blame every family. Some, of course, are at fault for not helping care for their children, but some children on their own are doing this. So it runs the whole gambit of parents who are not adequate caring for their children, but also those children who may be from families that have never used drugs before, who just decide they're going to be the first one in that generation to use. I have too many kids I'm going to their funerals for now. I had two young men OD on heroin and fentanyl about 2 months ago, and I went to both of their funerals. It's just a tragedy. And you can only go so many times and not have it really hurt you. It never gets old. Let me put it that way. I have on my desk in the courtroom, I show kids who enter my programs, that I have a pile of about 20 young people, pictures of them, who have OD'd over the last few years. And I tell these children, you're not a Superman or a Superwoman. They were just like you, and I show the pictures up, and I say, this child looks just like you. And they're dead. They sat there and they stood there, and they're dead now because of a heroin overdose, because of some other reason associated with drugs. So please listen quickly, listen now. Don't take anything you don't know what it is. In other words, don't take any drugs. But again, it's not that easy. You really have to focus on what their problems are at home, at school. Kids have so much trauma in their lives that we want to blame them all the time. And it's really not always the child's fault. They get into a situation and it's almost hopeless because of the trauma they've seen in their home. They've seen parents fighting. They've seen grandparents fighting. They've seen their friends die. There are a lot of children in my court who come to my court and say, my brother was shot and killed. My cousin was killed 3 months ago. And we don't understand what affects those kids, but all these different traumas are affecting children now. And so do I wonder why they try this thing? Not really. I wish they wouldn't. I wish they'd look for better ways to ask questions or better ways to understand society. But We can't just say enough, let's forget about it, we have to try and save them, and we're doing that.
Walk me through, I guess, someone who, from the arrest to how they get, I guess, referred to your docket and how the process is getting kids through the system.
Well, if a child's never been in the system before, they're picked up with possession, or they've OD'd, they're brought into the system. When a child's picked up with possession of heroin or fentanyl, they're brought in, they're arraigned like an adult would be arraigned. They appear in front of me. They're tested to see if they were using or just dealing. Then we deal with that type of situation. We have children that are OD, and they're brought first to the hospital and then to my court. I have kids in my drug court program who in the process of the program, use another type of drug. So they come in a lot of different ways. Most come in off the street because they've been picked up with possession. But every now and then we get a number of kids that are just OD, and they're brought to the hospital first, then to my building.
What are the ages of some of the youngest kids that you've seen here before you?
10. I don't see, I see 8-year-olds, but not really for drug issues. I see 10, 12, 14. I have a few 13-year-olds that are heroin addicts in my court. I have a lot of kids that try drugs when they're 8, 10, and 12. I know that marijuana has never been proven to be a drug that leads to something else. You hear all those stories that marijuana is not a drug that leads to something else. But I've never found a child in my court who started off with heroin. They've always started off with marijuana and then maybe cocaine, because they're always looking for a better, stronger, quicker high. And so, again, it's not a drug that leads you to one to the other. It's not if you use marijuana, you are definitely going to use heroin. But again, it doesn't work the other way. It clearly, if you use heroin, you use marijuana first. At least that's my experience. And so, we try and work with these families. But remember, so many children, their families have addiction issues. And so I have children in my drug court whose parents are currently addicted or have reformed from usage. It crosses every social economic type of family. I have poor kids in drug court. I have very wealthy families in drug court. So it doesn't touch just the poor, it touches children. And that's what I really want this story to show, is that it's not just an adult problem. As much as adults are using, if we stop them when they're children, we wouldn't have to deal with it when they're 18, 19, 21 and they're adults.
You said that 10, 12, 14, those are children. And do you think that when people hear this story, they're going to be shocked that, where are kids getting heroin at 10, 12, 14?
I'm sure they're shocked, but they get them on the street. I could tell you right now where to go in East Dayton and West Dayton and pick up heroin if you wanted to. It's just on the street. The kids know where it is. And I'm shocked myself sometimes when an 11-year-old says they're using heroin. It shocks me, but it doesn't surprise me. It's a strange kind of way to say it, but I'm shocked every time I hear it. But I understand it's happening. It's no longer the fact that kids don't use drugs till they're 17. It isn't like when they get to high school they start using drugs. We have kids in middle school that are using, and then are dealing too. So we have a lot of different situations. We have some children who receive their drugs from their parents and guardians, older brothers and sisters. I have a number of kids who I hear the first time they've used, and they're 12, is when their 17-year-old brother gave them heroin, something like that, or gave them cocaine. So, I think people will be shocked, but they need to understand they shouldn't be shocked in that we've been talking about this. I've been talking about it for years. I'm pushing for a local residential treatment facility for children. We have, I think it's 12 now facilities in the Montgomery County, Miami Valley area for adults, inpatient facilities. We have 0 for children. And I keep on saying we need a juvenile treatment facility in Montgomery County for the kids that we serve. Because right now, if I have a child who's a heroin addict, I have to send them to Columbus, Cincinnati, or Cleveland. We shouldn't have to do that in Montgomery County.
How different is, or is it the same when you're putting kids through a drug rehab program versus adults going through a program?
I think it's much harder for children because they're not mature enough to manage it. Adults that are in their 20s have much more life experiences. They have much more maturity, at least we hope. And so when you have a child who's 14 and 15, they're missing so many life experiences. They're missing the maturity. And so I think it's much harder to treat a child than an adult. It's just because of that maturity issue.
Are there, you mentioned there aren't any local resources for the juvenile recovery. What else needs to be done in this arena as far as targeting these young children and combating the issue?
I don't want to mislead. There are treatment options available in Montgomery County for our children, but there's no residential inpatient treatment facility. And that's key, because you want children to recover in their own community where their family, their support group can help them. And so if the closest place I can send a child to is Mansfield or Cincinnati or Columbus, that doesn't allow the family to interact during treatment. Okay, because in many cases, the family is a positive influence in the child's life. And so we have services here, we have very good outpatient treatment facilities, but there comes a point in time where children, because of their failures while on outpatient, need inpatient. And so we need that. We need it, and I'll be pushing for it. I continue to push for it, and I'm hoping by next year that we'll be able to have a residential drug treatment facility for children in Montgomery County.
Are you concerned at all that in the next couple of years this could increase even more and you would have even more numbers that you've seen over the last 5 years?
I think we have to assume it will. And we're doing everything we can to try and delay the growth. I don't think we'll stop it, we're going to delay it. There are a lot of resources in this community. We can always use more. And with children, it's hard to predict who's going to and who's not going to use. Kids are so transient, families are so transient now. It's a challenge. And so I wish I could say to you we have the problem solved, but we don't. I think Montgomery County is no different than other counties in the state of Ohio, except we have a pretty severe heroin problem because of our 70-75 connection. So in some ways, we're unique in that we're the crossroads of heroin and fentanyl because of where we are on the interstates. But another reality, the other reality is other communities, I've talked to judges all over the state, and the same kind of problems we're having here, they're having in Columbus, in Cincinnati, even the rural communities. Heroin and fentanyl, those are drugs that are touching everybody in this state of Ohio, not just Montgomery County.
When someone appears before you, what kind of consequences are they facing when you're talking about children in drug possession or drug use?
Well, it depends on the charge, of course, but really my focus is on rehabilitation. Juvenile court is different than adult court. In adult court, you convict somebody and you warehouse them, you try and treat them a little. In juvenile court, my primary focus has to be on rehabilitation. So if the child's using, dealing, just around people that are, I have to focus on what that child's need is. Try and deal with their mental health issues, deal with their socioeconomic issue, give them the treatment they need. You know, if we don't touch each other when they're 14 and 16 and 18, just think how much of a drain they'll be in our community, in our society at age 21 and age 30. We have to stop the problem early, and so that's why I keep on pushing the need for treatment, preventive treatment for children as young as we can start touching them.